Hello and welcome to Pregnancy Info. Today we are going to discuss the problem during pregnancy, which is incontinence, pregnancy and bladder control. During pregnancy, your growing baby can place a lot of pressure on your bladder. This can lead to urine leakage. Bladder control problems can happen both during pregnancy and after childbirth. Causes of bladder control issues can include pelvic organ prolapse, weakened pelvic floor muscles, and damaged pelvic nerves. But you have to know that what is incontinence. Urinary incontinence is the inability to control the passage of urine. If you experience incontinence, you might feel an urgent need to urinate or leak urine between trips to the bathroom. You also might find that you have to make frequent trips to a toilet. If you have incontinence, this can happen for many reasons, including pregnancy, childbirth, and age. You have to know that how does the bladder work. Your bladder is a round muscular organ that's located above the pelvic bone. It's held in place by the pelvic muscles. A tube called the urethra allows urine to flow out of the bladder. The bladder muscles relaxes as your bladder fills with urine, while the sphincter muscles help to keep the bladder closed until you're ready to urinate. Other systems of your body also help to control the bladder. Nerves from the bladder and signal to the brain when the bladder is full, and then nerves from the brain signal to the bladder when it is ready to be emptied. All these nerves and muscles must work together so that your bladder can function normally. Effect of pregnancy on your bladder working. During pregnancy, you might leak urine between trips to the bathroom. This is called incontinence. One type of incontinence that can affect pregnant women is stress incontinence. If you are experiencing stress incontinence, you might leak urine when you cough, laugh, do physical activity. Your bladder rests under the uterus. As your growing baby expands, the bladder gets compressed, making less space for urine. This extra pressure can make you feel the urge to urinate more often than normal. Usually this is temporary and goes away within a few weeks of baby's birth. However, the risk of experiencing incontinence after pregnancy often depends on your particular pregnancy, the type of delivery, and the number of children you have. Women who have given birth by vaginal delivery or C-section are at a much higher risk of stress incontinence than women who have never had a baby. Here are some causes of this incontinence. Number 1. Pelvic organ prolapse. If the muscles around your bladder become weak, the organ can actually slip out of position. This condition is called cystoscopy. Pelvic nerve damage. The pelvic nerves that control your bladder function can get injured during a long or difficult vaginal delivery. Injury during delivery. Sometimes delivery with forceps can result in injuries to the pelvic floor muscles and anal sphincter muscles. Injury because of prolonged pushing. Prolonged pushing during a vaginal delivery can also increase the likelihood of injury to the pelvic nerves. Actually, it's very common in pregnancy or after giving birth. As your body changes throughout pregnancy to accommodate a growing baby, the bladder can be placed under pressure. This is normal for many women during pregnancy. For diagnosing the problem of incontinence during an appointment, your healthcare provider will perform a physical examination to rule out various medical conditions and see how well your bladder is functioning. Your provider may also order various tests including urinalysis. During this test, you will be asked to provide a urine sample. This sample will be analyzed for possible infections that cause incontinence. Ultrasound. Images produced by ultrasound waves can make sure that your bladder is emptying completely. Bladder stress test. During this test, your provider will check for signs of urine leakage when you cough forcefully or bear down. Cystoscopy. This test involves a thin tube with a miniature camera at one end being inserted into your urethra. Your provider will be able to look inside your bladder and urethra during this test. Urodynamics. A thin tube is inserted into a bladder during this test. Water flows through this tube to fill the bladder so that pressure inside the bladder can be measured. Now, how can bladder control these problems? There are several techniques for treating bladder controlling problems, like switching to decaffeinated beverages or water to help prevent urine leakage. Drinking beverages such as carbonated drinks, coffee, and tea might make you feel like you need to urinate more often. Limited the amount of fluids you drink after dinner to reduce the number of trips to the bathroom you need to make during the night. Eating foods that are high in fiber to avoid being constipated, since constipation can also cause urine leakage. Maintaining a healthy body weight. Extra body weight can put additional pressure to the bladder. Losing weight after your baby is born can help to relieve some of the pressure on your bladder. Keeping a record of when you experience urine leakage, it's a good idea to keep track of what time during the day you have urine leakage. If you can see the pattern, you might be able to avoid leakage by planning trips to the bathroom ahead of time. The best exercise for this problem is Kegel exercise. Kegel exercise, also called pelvic floor exercise, helps strengthen the muscles that support the bladder, uterus and bowels. By strengthening these muscles during pregnancy, you can develop the ability to relax and control the muscles in preparation for labor and birth. Kegel exercises are highly recommended during the postpartum period to promote the healing of perineal tissues, increase the strength of the pelvic floor muscles, and help these muscles return to healthy state. To do Kegel exercises, imagine you are trying to stop the flow of urine or trying not to pass gas. When you do this, you are contracting the muscles of the pelvic floor and are practicing Kegel exercises. While doing these exercises, try not to move your leg, buttock or abdominal muscles. In fact, no one should be able to tell that you are doing Kegel exercises. Kegel exercise should be done every day. Doing 5 sets of Kegel exercises a day is recommended. Each time you contract the muscles of the pelvic floor, hold for a slow count of 10 seconds and then relax. Repeat this 15 times for 1 set of Kegels. I hope I have explained all about the bladder control problem or the urine incontinence problem during pregnancy. If you find this video useful, then like it, share it, and also subscribe our channel. And you can give your precious suggestions via comment section. Thank you.